by laying your cheek down, what that does, you see how that got her spine a lot more horizontal. So we can get a lot more benefit as opposed to where her uterus is kind of resting down more into her pelvis. We can release more of the muscles that are tight. So this usually feels really, really good. So partners, this is one that you'd be helping with, or you would find a friend if your partner's not available. So a lot of us, when we are interacting with a pregnant belly, are more timid than we need to be. So if you're like, oh, I don't want to hurt the baby, and you barely move it. Babies are, first of all, very, very rugged creatures. We think of them as very fragile. They are not.
That's to keep them safe from the 3.5-year-old.
Right, exactly. They can survive that T-Rex in their lives. So the other thing is they're very well protected. There are thick layers of muscle, there's amniotic fluid, they're inside a bubble. So if they get bumped one way or the other, they're just bouncing into more water and soft muscle. So you really can't hurt them. There's nothing risky about doing this particular position. So you want to be more assertive, or coach your partner or helper to be more assertive than maybe they would naturally be. So the first step is to actually lift the weight of the uterus. So you're pulling up, and that alone is usually like,
Yeah.
it feels so good, because only your muscles have ever been holding that weight up, and there's not very many other ways for the muscles to get rest. So you pull up, and then you just gradually start to sift like this. And you start out kind of slow, and then you work your way up, and you get a little faster and a little bit stronger. And this is helping to release that network of muscles in front of the uterus that we talked about, while also resting the back muscles that they're not overly tight. So that there's space where we want there to be space, and there's strength where we want there to be strength. And then you would continue this for at least 15 minutes, or at least 10, I would say. 15, 20 is great. Whatever you can get. It is tiring for the person who's helping. So, just think about all the things that you're not carrying because you're not the pregnant person, and hang in there a little longer than you normally would, and take breaks when you need to, but be willing to kind of hang in there and endure some discomfort a little bit, for the sake of your lady,
Is there
baby.
time that you don't want to be doing it? Like, I know it's better like in between contractions, obviously, but like in terms of weeks, how many weeks along, or is there some time when you just absolutely shouldn't do it because of?
There's not a time where you shouldn't. It's going to be the most beneficial during the third trimester, probably after 34 to 35 weeks.